Universal Precautions represent a cornerstone of infection control in healthcare, designed to prevent the spread of diseases. Rooted in the principle that every patient may harbor infectious agents, these precautions require us to treat all blood, bodily fluids, secretions, excretions, except sweat, non-intact skin, and mucous membranes as if they are potentially infectious. This is especially critical in our clinic, where the nature of auto-injury treatments may involve frequent physical contact and the need to handle a variety of patient conditions. The pillars that uphold universal precautions include hand hygiene. Begin and end every patient interaction with thorough hand washing. Whether with soap and water or an alcohol-based hand sanitizer, this simple act is your most powerful weapon against the spread of infection. In a chiropractic setting, where you may move from one patient to another in quick succession, diligent hand hygiene is essential to protect both yourself and your patients. When washing your hands with soap and water, make sure to scrub all surfaces, including the backs of your hands, between your fingers and under your nails for at least 20 seconds. Rinse thoroughly and dry with a clean towel or air dry. In situations where soap and water are not available, use an alcohol-based hand sanitizer containing at least 60% alcohol, rubbing your hands together until they are dry. Personal protective equipment, PPE, gloves, gowns, masks, and protective eyewear serve as your armor against exposure to infectious materials. Equip yourself appropriately for each situation, especially when dealing with open wounds or when there's a risk of exposure to bodily fluids. Ensure that PPE is removed and disposed of with care to prevent contamination. While some PPE, like gowns or full-face shields, may be less frequently used in a chiropractic setting, they still need to be readily available for situations where more extensive protection is required, such as when assisting with procedures that could generate splashes or sprays of bodily fluids. Handling sharps. Needles, scalpels, and other sharp instruments require meticulous care to prevent injuries. Avoid recapping needles and promptly dispose of all sharps in designated containers. Given the nature of treatments in a chiropractic clinic, such as injections or acupuncture for pain management, it's vital to handle all sharps with the utmost caution. Although incidents involving sharps are rare in our setting, it is still important to know the proper protocol in the event of an accidental needle stick or sharp injury. If such an injury occurs, immediately wash the affected area with soap and water, file an incident report with your supervisor, and follow the clinic's exposure control plan, which may include seeking medical evaluation. Disinfection and sterilization. After each patient interaction, rigorously clean and disinfect all surfaces and equipment. Use only EPA-approved disinfectants and adhere strictly to manufacturer instructions. Reusable instruments, such as those used for soft tissue manipulation or therapeutic interventions, must undergo sterilization as per clinic protocols to prevent cross-contamination. Safe handling of specimens. Very rarely, you may have to deal with handling specimens, such as blood or bodily fluids. When doing so, always don gloves and utilize leak-proof containers to maintain a safe environment for both staff and patients. Waste disposal. Contaminated waste, including gloves, dressings, and disposable instruments, must be discarded in designated biohazard containers. Always follow local regulations for biohazardous waste disposal to ensure that our clinic remains a safe and compliant space. At the very least, make sure all trash bags are taken out daily. Remember, universal precautions are more than just a personal safeguard. They are a commitment to the safety of our patients and the prevention of infection spread within our clinic. With many of our patients recovering from auto-related injuries, their immune systems may be compromised, making these precautions even more critical. Remain ever vigilant, adhering to these guidelines in every patient interaction and when handling potentially infectious materials. Your dedication to universal precautions is vital to maintaining a safe and healthy environment for all.